Good afternoon. Welcome to the St. Clair County Emergency Management Agency daily briefing. We're here to bring you the latest information that's been provided to us. We're joined once again by Sam Bierman from the St. Clair County Health Department. Sam, it seems like these days are coming fast.
They are, and as we have said before, it feels like Groundhog Day. We're reliving the same day over and over. We do have some updated numbers for you guys today. As of today, 321 residents from St. Clair County have been tested. We have a number of 43, which are positive, two more from yesterday, a female in her 40s and a male in his 40s. We have 204 negative cases, 74 pending, and 2 deaths, which has remained the same. An important point that I would like to note before we move on to our Illinois state totals is that with our 2 new totals today, our 2 new cases today, that does not mean we have hit our peak yet. As you guys have heard on briefings past, the governor would like to increase the amount of tests we do daily. With the increasing of tests, also increases our result time. So just because we only have 2 new positives today, that doesn't mean that we've reached our peak. That just means that the labs may be a little bit backed up. And as we said, we have 74 pending, which could go anyway. So please keep that in mind when we give our totals daily. For Illinois state totals, we are at 35,225 that have been tested, 5,994 positive, which is an increase of 938 from yesterday, and 99 deaths, which is an increase of 27 since yesterday. So as you can see with the state totals, we are still clearly on the upswing. We have not hit our peak yet. So keep that in mind when we report our numbers daily.
Thank you, Sam.
Mm-hmm. And now I would like to introduce Chairman Mark Kern.
Great. Thanks, Sam. Thanks
Absolutely.
for the good work. As many of you may know, earlier the Governor Pritzker extended the shelter-in-place order through April 30th in the state of Illinois. So we'll be staying in our homes, sheltering in place until the end of the month. It appears from everything that we're being told that we have not peaked yet, and you just heard the numbers. We continue to go up. We think that peak will be closer to the middle of the month. So that is the reason for the extension until April 30th of the shelter-in-place order. This morning, we were involved in a teleconference call with the regional leaders, the mayor of St. Louis, Steve Ellman, Sam Page from St. Louis County, Steve Ellman from St. Charles, and our counterpart from Madison County. We're all on the call, and everyone's doing good work, trying to make sure that we're consistent in our efforts so that we can slow the growth of this virus. As far as the governor's comments today on schools, and I know many are interested in what's going to happen with this school year, we're going to clarify and update on that issue tomorrow. Susan Sarfati will appear here from the Regional Office of Education. Susan is the Regional Superintendent of Schools, and we look forward to that. We're joined today by Brian Kraus. Brian is a teacher at Grant Middle School, and Brian's going to update us on how things are going in schools these days. Brian?
Absolutely. Thank you, Mark. We are still working on feeding all of our students. That's one of our main priorities, is feeding students every single day. So we are still providing lunch through our lunch programs. Whoever would like a lunch gets a lunch. No questions asked there. As for educationally, we're looking at remote learning, which is a little bit different than e-learning, but we're still continuing instruction and continuing their education at home. The way they get a lot of that content, stay in touch with their teachers, stay in touch with your school, and we also reach out to them individually. So some great ways of utilizing the Google Suite that they're all pretty familiar with, and just continuing to push at home. I know it's tough for a lot of parents, and we understand that as teachers. So we're still reactive to them, so keeping them engaged throughout this period where we're out of school.
So do you issue tablets to the students? Is that the way this is going?
Currently, yeah, Grant CCSD 110. If a family requests one, they come up, sign a waiver, and they're allowed one per household to take of our stock home that they're able to use. As for internet, I know it's a lot of issues for equity across the board. I know Charter's providing internet installation for 60 days. So if you call up there, they'll install. If you have a K-12 or university student, they'll provide that to you. So it's great to be able to do so. I mean, it doesn't fill all the equity gaps, obviously, but we're trying our best to make sure that we get it all out there for them.
So, and with the meals, you call your local school district, arrange for the meals, the equipment. Any questions? Really, contacting your local school district is the best way.
Absolutely. So, if you check, especially whatever communications coming down the pipeline from emails, phone calls, or checking district Facebook pages, you'll be able to see, especially pickup times. If you call the offices, they'll be able to direct you, hey, this is our pickup time for any meals. And we're going to continue to see that support go on.
So tell me, how does a typical class work now? So if I'm a kid and you're my teacher, how are you getting to, how are you teaching?
Oh, it's definitely different from class to class. Obviously, I teach 8th grade English, and so I've got that kind of intermediate area of students. And so right now, I mean, we're big on technology instruction, and so continuing whatever skill you're working with, but transforming it onto the computer. There are a lot of great platforms that a lot of students are meeting their teachers on. So Zoom and Google Meets, where you get to have really kind of that socialization interaction that you want to have in school that we're missing out on. So we get to have a lot of instruction over that way, as well as just getting them acclimated to using email and sending the email to your teacher and saying, like, hey, I've got a question. It's been quite interesting. It's been kind of a fun experiment, but at the same time, we want to make sure we're still enriching their education and continuing on with this so that they are feeling like they have a whole school year. And so still continuing instruction, sometimes in person, sometimes on their own timetables, because everyone's kind of on different timetables at their homes.
So I imagine your workday is extended.
Yeah, I mean, a teacher's workday is really never over. You can always find ways to do things, even when we were inside of the classroom. But yeah, it just looks differently, and so you keep a closer eye on your email. Know to reach out a little bit more. You don't get to go tap someone's desk. You have to send them a quick email or call mom or dad quite often. So yeah, it's just big communication, whatever way you're using before. Calling parents, using certain apps like Class Dojo or the Remind app are great resources they can use to keep in touch as a big group. And so yeah, just maintaining communication, maintain those relationships you have with students, and know that us as teachers, we're here for you. This is not a vacation for us. It's definitely stressful for us as teachers.
Brian Krause, the students at Grant Middle School are lucky to have you.
Thank you, Mark.
We appreciate you being here today.
Chairman, let me ask a question.
Yes,
Brian,
sir.
thanks for coming in. And we know the stress that it is on the children at home and the parents. How is it on the teachers? I mean, it's got to be rough on you.
It's an uncertain time for us as teachers, because none of us enjoy being behind a computer. That's the first and foremost thing. And my eyes hurt most days staring at the screen for the amount of time. And you want to make sure that all your students are safe, and you miss seeing them every single day. I think that's the biggest thing. Is although the teachers are like, oh, the students are like, oh, the teachers don't miss us. No, absolutely. I miss my students every single day. I had a parent text me and said, yeah, one kid was asking about your terrible jokes that you make in a day, and I go, yeah, I don't get to make as many puns in English class throughout the day. As well as parents reaching out and saying, your job is hard. And I said, yeah, your job's hard as well right now. And they said, whatever you need for next year, you let us know, because we know that your job is very, very tough.
So what advice could you give the parents that are sitting at home with their children, trying to juggle the house, the work, some of them's off work? What kind of advice would you give the parents?
Routines. Routines are great. Getting up at a certain time, making sure that people are getting up. Spending time away from the screen, I think, although instruction is taking place on the screen, there's a lot more out there educatively in the world. Going outside, if you have the space in your backyard with siblings, making sure you're getting physical education and exercise outside is extremely important. And then my biggest thing that I like to do is I just think mindfully, and just have those chats, because if we're uncertain as adults, you can only imagine how children are feeling in this uncertain time. So making sure you're having those kind of clarity of chats with your youngsters.
Well, great. We appreciate you being here. As Chairman Kern said, it's always good to be able to relay that information to the parents, and hopefully some of the students will see you on air and they'll know that you have to tell us one of your jokes later on.
Oh, they're terrible. They're definitely corny. I might lose some viewership that way.
Thanks, Brian. We appreciate it.
Absolutely. Thank
Very
you.
good.
Thank you.
Yes.
So during this time, we got to remember we keep our washing our hands. Stay 6 feet away from the nearest person when you go to the store. Try to practice that social distancing. I was in the grocery store this morning shopping for my mom, and people are trying to stay apart, but you always have some folks that maybe didn't get the message, and so there's really nothing wrong with if they're getting too close, asking people to kind of stay the distance in a polite way, because this is serious business. You are a carrier perhaps if you do get infected, and you don't want to carry it to someone whose immune system cannot handle COVID-19. So we are also lucky today on this show to have Dr. Robert Farmer. The good doctor is Southern Illinois Division Medical Director for HSHS Hospitals. Welcome, Dr. Farmer. We appreciate you being here today. How are things going at St. Elizabeth's?
Appreciate you having us. Things are different. It's a very different time at the hospital for as it is for all of our medical teams. You would think at a time when we have a nationwide, worldwide pandemic that all hands would be on deck, and they are. But there's a lot of our medical personnel that are kind of sitting waiting to see where they may be redeployed from their usual daily routines into other routines. So we have family physicians that are kind of waiting to say, gosh, I'm not seeing very many patients right now because people are adhering to the stay-at-home orders. We've asked patients not to come in for routine things. We don't want them to come in. We want to keep people at home and keep the healthy people away because we don't want to expose them. And let's face it, hospitals, have sick people, and so we try to avoid bringing people in unnecessarily. So there's a lot of people, doctors, nurses, a lot of team members that are sitting around. They're doing what they normally do, but they're less busy. And if we have a surge that we could, in fact, have in coming weeks, we may need to use those people in places they're not, usually being used, but they're ready to step up and walk back into the hospital if they're a family physician that hasn't been there for a while, and help the hospitalists out, or help in the triage, or help take care of patients that may, where the census goes back up. Right now, the census at our local hospitals is down because we're not doing elective surgeries, we're not doing things that aren't necessary. We're trying to, just like the rest of the population, stay at home and stay healthy.
So are these are people who normally aren't working in the hospital? Could it be someone from a different practice, like a dentist, or are all of those occupations, are they fertile ground for finding help if we do spike?
Sure, and the appropriate, what we did, so we have our medical group, HSHS Medical Group, is associated with all of our hospital ministries in Illinois and Wisconsin, basically we sent out a survey to all of our physicians and nurses and nurse practitioners, and basically said, hey, in the event that we need your help, what can you do and what would you be willing to do to help us? And we had an overwhelming response from people saying, well, I used to be an ICU nurse. Now I'm a family nurse practitioner. I would love to be able to go back into the ICU to help if needed. So we've actually, and we shared that information with other hospitals, and I think they're doing it as well. We're basically getting the bench ready to come in and help in the event that our first line folks either get sick themselves or become overwhelmed with too many patients. We're planning for the worst, but hoping for the best.
Do you have enough supplies?
Right now, we have enough supplies currently. If we encounter this surge, like they talk about through all the media, we are going to be taxed to have enough supplies. It's a week by week thing. We would ask the public if they have supplies at home or in their garage or wherever, the closet that you forgot about when you came home from the hospital after your knee replacement, and you have some extra supplies. We're really interested in N95 masks. We're interested in surgical masks, medical quality, medical grade masks, and gowns, eye protective wear, we've had a wonderful response. Schools have brought in lab eye protection, and people have been just very generous, and it's a great thing to see our community stepping up and across this country to help. But we really need those medical grade type supplies. If you have them, our doctors and nurses in the ERs and on the units are going to run out if we see the surge. Right now we're okay, but it's going to get iffy.
So how about people that are making masks? I see people are talking about patterns online and coming up with fabric. Do you accept those? Do you want those, number one? And number two, are there specs as to how you want them made?
Sure. So first and foremost, we want the real things. We want the N95s and the surgical masks. There may, in fact, be a use for these homemade masks. A lot of people are making them out of double-layered cotton and certain things. There may, in fact, be uses for those. The CDC has basically commented that that's an option of last resort right now. But as supplies get short, people have to get creative and come up with ways to either prolong the usefulness of N95s, for instance. There's been discussion about putting these homemade masks over the N95s to allow those to last longer. This is all day by day evolving information that we're all trying to figure out. That's a long answer to your short question, but to expand on that further, we are probably going to use some of these homemade masks. In fact, it's interesting, a few years ago, radio show host Delilah came to Belleville to help paint the town. Many people probably remember that. And through that, my wife and I got to know her fairly well, and I serve on her national board called Point Hope. And she called me a few weeks ago. She lives out in Seattle, and she basically said, we're running out of masks. Should I put out a nationwide call for homemade masks? And at the time I said, well, there's OSHA requirements and there's all these regulatory things. I'm not sure the hospitals will be able to take them. But there may be a place for that. And 2 weeks later, I'm calling her back and said, are you still willing to put out your call to the nation? Which she has, and she's got a website, Delilah.com, and she's got an initiative called Hope Masks for her Point Hope, and she's hoping to get her listeners in this country, kind of like War Bonds effort or Victory Gardens, to take their time when they're at home with their families and watching movies, doing board games. Well, let's also make some masks. And if you go to Delilah.com, there's a area under there that talks about these masks, and there's patterns. One's from Deaconess Hospital over in Evansville, Indiana, that basically kind of give you an idea how to make these. And what we would ask is what she's asking is anywhere in the country, if you make these masks, contact your local hospitals and say, how can we get these to you? Don't drop them off at your hospital. We don't want you coming to the hospital. I think here in St. Clair County, we can come to the emergency management building here on First Street, right behind the courthouse. And you guys are accepting those, which we greatly appreciate. And then we can kind of figure out from a healthcare perspective how we can best use those in the appropriate manner, because they're not going to be able to be used for everything, but they may have a place, and we'll gladly accept them.
When America pulls together, we can get anything done. We
Yes.
can beat anything, including this virus. Tell me about, we hear about the flattening the curve. Can you just tell us how important that is and exactly what that means?
So when you hear the media talking about flattening the curve, what we're saying is what we want to avoid is, and you hear the surge, that means we get a whole bunch of cases all at once, and we get a whole bunch of sick people all at once. So they're describing the curve as a very vertical, you got a baseline, big vertical, hump, and then a baseline. What we want to do is take that big curve and we want to flatten it like a pancake. So there's still going to be the same amount of people under the curve maybe, but instead of it all being experienced in a narrow window, we flatten it and we experience it over a longer period of time. The reason for that, and the reason for the social distancing, the reason for the stay-at-home orders, the reason for everything we're doing to try to avoid each other, is to avoid a surge and a spike, and we want to flatten that curve. Does that mean we maybe prolong this? It could, but it also means that we have the resources, both medical personnel, first-line responders, protective equipment, medications, all the things we need to be able to take care of people over time. We can take care of a lot more people a lot better if we have more time to do it. if we are faced with what Italy was faced with, they had a really vertical curve, and they had some bad outcomes. And so we're trying to make that curve flat, make it last longer, so that we don't overwhelm our resources.
And we'll have the least amount of fatalities from this virus.
Yeah, and I think what we're seeing is, a month ago we were talking a 4%, 5% mortality rate coming out of Europe and China. Worldwide, it's gotten better. In the United States, it's just shy of 2%. I think it's about 1.7, 1.8% right now. I think as we find out, as we do more testing and those supplies become more available, we're going to find out that it's a lot more present in our communities than we already know. And most people are experiencing just colds and flu symptoms and not much else. And I think we're going to find out that mortality rate is even less than it is, but it's a much more serious disease than your typical influenza. It kills more people, as far as percentage-wise, and it's not something we want to mess around with, because when it hits these folks that don't do well with it, it hits them hard, it hits them fast, and it can be really hard to recover from, especially if you get on a ventilator.
So, in line with that, let's talk about the virus germ itself. Tell us why 20 seconds of hand washing is imperative to be able to kill that particular strain of virus.
Sure, I think that's a wonderful question, because we tell everybody, wash your hands and sing the birthday song, or sing alphabet song, to try to get you doing that for 20 or 30 seconds. The science behind that people really don't talk about, but the virus is not really a living organism. It's a protein. It's an RNA or DNA type protein that's not really in and of itself a living organism, and it's surrounded by a fat layer, a lipid layer. And that fatty lipid layer protects the protein, which basically, when it gets into a host organism, then replicates and causes all of its problems. Washing your hands, the sudsy, soapy water, basically, and the 65% alcohol hand sanitizers, either one, they act in the same fashion to degrade the outer fat layer of this virus. And once you degrade, it basically drops its defenses. And once that's degraded, you have an exposed protein, which then degrades and basically, I'd say dies, but it's not living, but it basically degrades and goes away. And so the reason that it's so important to wash your hands, and to do it for at least 20 or 30 seconds, preferably with very warm water, doesn't have to be hot, but warm seems to work better than cold, is that the combination of the suds, the combination of the detergent or the soap or the alcohol base with the rubbing causes the lipid layer to disintegrate, and then the virus then degrades. So if you understand the science, maybe it makes it a little easier for you to understand why you're doing it. And I think that's important to know. And people talk about, can you just take some vodka or something, because it's alcohol. It takes about a 65% alcohol base to kill this stuff, or to make it so it's susceptible to degradation. And vodka, if it's 80 proof, is only 40% alcohol, so that won't get the job done. So save the vodka for other reasons.
No, that's good advice. So after a person has COVID-19, whether their symptoms were strong or whether they barely knew that it was around, is there a certain amount of immunity that comes to the system by that? Is that going to play into the overall length and how we're able to fight this virus?
Sure. If it's like other bacteria or other viruses and other types of infections like this that we've encountered in the past, the answer is yes, and we hope so. A lot of times, that's the reason we give immunizations. We basically expose the body to a small amount of the antigen, or the thing that basically causes our immune response to kick in to fight it. And the whole idea behind that is so that once we've recognized it and figured out how to fight it, then we don't have to worry about it in the future. So we think this is probably going to be in the same type of thing, and that's why we think immunizations can be made against it. And that's why they think even in some cases, like in New York, they're looking at using the plasma of patients who have had it and been exposed to it and tested positive and survived and did fine. They're wondering, can you take the blood plasma of somebody who's a survivor, and then use that, because the antibodies exist in the bloodstream, for for people who are very sick, maybe we can give them transfusions of plasma and help them. We don't know. That's all experimental. It's all stuff we're finding out each day and week as we encounter and try new things. But in theory, once you get this, you should have an immunity to it, and you should hopefully not be able to get it again, although there's exceptions to all that. So.
Herb, do you have any questions?
Man, I could sit here all night and ask questions. This is really informative, and I think our viewers are going to really appreciate this, Doc. Just a few follow-up questions. We get a lot of questions on our briefing. Why anybody just can't come in and get a test? And, we've heard the stories, lack of tests. Is that fair? The test kits, is that...
Yeah, so fair question. There aren't enough tests to test everybody that would like to be tested, bottom line. We had hoped by now we would have, been able to make those or get those available on a more widespread use, but we haven't. There are more than there were a week ago, a lot more, and we are testing more people than we were. But we still have to sort of triage those tests, so to speak, to the people who probably are at most risk. So if you have the sickest patients that look like they have the symptoms, we need to know, is this what they have? Because if they're hospitalized and maybe in the intensive care unit, we need to, number one, know what it is we're treating, confirm it. Number two, how to protect ourselves on the healthcare line, because you got to know, what you're walking into. So, and other patients. So you have to know whether to isolate patients and so forth. So we reserve the tests right now for, the sick that we think have it, we want to know. And then people that are on the front line. There's only a finite amount of, EMT personnel, nurses, emergency room triage folks, doctors. These folks all need to, if they get exposed or they start having symptoms, we need to figure out whether or not they have it. So if they got it, we need to keep them at home and keep them away from everybody. If they don't have it, we need to get them back on the front line as soon as they feel like it, because we need to have them back in the arena, especially if we do encounter a surge in a few weeks. And again, that's all speculation, we don't know. But if we encounter that, we're going to need all hands on deck, and we're going to need to be able to get people back in the game quicker, especially if they have a mild case. But we need to know whether or not they had it. So it's not fair. I wish everybody could just go get a test and we'd know, but we don't. And the other thing the public should be aware of is the test doesn't necessarily, peace of mind, do I have it, do I not have it? That's important, I get that. But it doesn't necessarily change how we would manage your illness. 80% of people who get this probably are going to have mild cold symptoms, cough, maybe a little shortness of breath, maybe a little bit of rundown feeling, maybe a sore, scratchy throat, maybe some mild gastrointestinal symptoms. Different things are evolving, but the main things are cough, shortness of breath, scratchy throat, maybe a fever. Fever's the big one too. Does that change how we would treat you? Well, not necessarily. We don't have a treatment. If you're mildly ill, we treat the symptoms. So we have you take your Tylenol for your fever and drink fluids for, stay hydrated and all the stuff that mom taught you to do. And we do all that. It doesn't change. And also we base our return to work today on symptoms. So, we want, like if a healthcare worker potentially was exposed, but we haven't been able to maybe do a test, which we haven't been, we basically say, well, we want you, at least 7 days from onset of symptoms. Well, we want you 72 hours without a fever. We want your respiratory symptoms to be gone or resolving. And then and only then will we consider letting you go back, and we'll probably put a mask on you when you go back, because we have to protect others. And so there's just not enough tests to go around. Hopefully we'll get to a point where there is. Quite frankly, when we get to that point, it may not matter, because it may be so, present in the community that if you got a cough and cold, you're going to be presumed to have it. And testing may not change a thing. But right now, we're trying to reserve those as best we can for the healthcare workers and the frontline workers and the obviously ill, so we know what we're encountering.
Good. And I'm sure that answered a lot of their questions. A lot of speculation out there that everybody should wear a mask. In fact, we saw a couple of calls come in today that there was supposedly CDC was going to recommend that. Is that a rumor? Do you know? Or
as far as I know, it's still a rumor, but we talked about it today based on some of these rumors and the CDC. Strangely enough, they evolve too. Week by week, day by day, they kind of alter their message sometimes. And that's understandable. We haven't all been through this. This is something new and different, and we're finding our way through it, sometimes stumbling our way through it. certainly the idea of a mask to not necessarily protect you from everybody else, but protect everybody else from you, may be reasonable. For instance, if you got to go out to get groceries and you had a cotton cloth mask that was homemade, that may actually benefit the people around you, the store clerks, the checkout team, because we've all coughed or sneezed, and if we put our hand up and gosh, there's moisture there, think of all those respiratory droplets spreading. Cloth masks from a medical grade, I mean, these viruses are less than a micron. They don't stop little tiny things from going through pores in cloth masks. But in theory, you'd like to think that a lot of those particles may not get spread by a barrier. And so there may be a use for those. One thing I caution people against is, if you wear a mask too long, and this is just kind of common sense almost, when we breathe out and we exhale, there's moisture there from our exhalation. That moisture builds up inside your mask. Moisture can then attract other things. And so if you've got a moist, warm mask and you wear it too long, you could make the argument you put yourself at greater risk because things that come in contact with that mask then have a nice, warm, moist environment to replicate in. So the jury's still out on masks. There's not a lot of studies on masks. There's a few, and the old adage in medicine, for every study you can find a study that contradicts the previous study, is true. So there's very little data. In theory, they may help us. And I don't know what the CDC is finally going to tell us on this. Right now, at least the cloth mask, the homemade mask, they basically said there may be a role when all other options are exhausted. That's about as vague as you can get,
Right.
Because they don't know yet.
Exactly. It's a revolving thing.
It is.
And one last question that comes up all the time, visitors allowed at the hospitals. Some people just cannot understand why, if their loved one is in the hospital, why the hospitals are restricting visitors.
Yeah, it's a very sad thing to not be able to visit a loved one who's sick. That's almost, you're like, what? That doesn't sound right, doesn't sound very humane. It's a population health management issue. In other words, if we've got sick people in the hospital and they've got a contagious virus, and despite all of our best efforts, we try to prevent the spread of that virus, we know it'll still spread. And the last thing we want to do is have two people laying in the hospital next to each other because we didn't protect the one person from the person who we knew had the problem. And yeah, it's sad and it can be, really something you don't want to have to think about. But, luckily, I mean, for many, they can do FaceTime and they can do other things and get that social interaction. But yeah, it's a harsh reality that we want to limit people coming in and out of those hospital doors. We even limit our own medical staff. In other words, when we walk in the doors at St. Elizabeth's Hospital, you can only go in one or two doors, and they take your temperature and they ask you a questionnaire about your symptoms or if you have any. And if you have yes, you're not coming in. And so it's not just visitors; it's our own staff, and it's meant for the protection of patients and to really cut down on the community spread. Because it's not just coming from cruise ships or Italy, it's coming in the community. It's obvious, it's here, it's spreading, it's been here a while. And so the only way to stop the spread is to get people, away from each other as best we can.
And stay home.
And stay home.
I have one last question. Some of the followers were asking if you could explain, they're hearing all this about the peak. And everybody's speculating it's going to be 2 weeks, a month, or whatever. Can you explain what they're talking about when they talk about the peak?
So that's an exercise in epidemiological studies is what it is. It's when you start to get an outbreak in a community, how quickly, how fast does the outbreak peak, and then you get over the bad point, and then it starts to, so you get too many. That's the point of most cases, and then after that, it starts to fade away over time. That is an area of great debate. I've sat in a room with a lot of really smart people, and a lot of really smart people have a lot of differing opinions on this. Partly because data is incomplete. You'd like to think the data from China, people quote that, but let's face it, that's up for argument. Are we getting what we need to know from China? Probably not. Italy, probably a little bit closer. I think we can trust that data maybe. I think that's the common thought. Is that data better, we think, and then we try to model off of that. Well, if it happened in Italy, what can happen in the United States? But even that can sometimes be an exercise in futility because it's different demographics, it's different size cities and towns, it's different clustering of people. And so the idea of a peak is when are we going to meet the maximum time of exposure where most people have it, and then hopefully then we get over that hump, and then we can start to feel like we're on our way to recovery. A lot of people have speculated a week or two. If you look back, I think 7 days, maybe about 8 days ago, New York City had 40,000 confirmed cases. Now they have 160,000 cases. So 4 times the number of cases in 7 days. Does that mean next week are we going to still have 4 times? We don't know. Is it exponential? Is it going to flatten? Hard to say. What we do know for sure is social distancing, staying home, washing hands, being smart. Don't go out unless you really need to. Those things, as population health management of an outbreak of a pandemic, those work, and they flatten the curve, and they make it so that if you're the unfortunate one that gets sick, that we have the resources, the people, and the supplies to be able to take care of you, because not everybody got sick at the same time. So, as much as we all want to say we're going stir crazy, we got to get out, we got to do things. You're doing your patriotic duty if you stay home and wash your hands and bond with family. And I've got 2 of my 3 kids are in college. They're back home now. So last time we sat down for a family dinner was a long time ago, but we're doing it a lot now. And so we're trying to find the cool things out of a bad thing. And
That's good.
but the community, if they wash their hands, socially distance, stay home, they'll help us a lot, and they may in fact help themselves.
Good.
Dr. Farmer, we really appreciate you being here today.
Appreciate
Been
the opportunity.
Highly educational.
Well, I appreciate it.
Very good.
Thank you guys for all you
Thank
do.
you.
Thank you, Doctor. Thank you, Chairman. Boy, I'm telling you, I hope that was very informative to you. Has answered a lot of your questions that you've been sending in. Just a few other things before we wrap up here. We had our morning conference call with the hospitals and our EMS providers. We do that every morning at 8 o'clock, and we'll continue to do that. We delivered some hand sanitizer to one of the local hospitals today that was running short. We're still waiting for a shipment. Hopefully later on this evening, our second shipment of that will come in, so we can continue to provide that. If you saw our post, we've throughout the county, we have placed strategically 7 of the big roadside signs, trying to keep it out there for people who are having to work. Just a reminder, go to work, come back home. Those signs are out there along the highways and high travel areas that says COVID-19, social distancing, stay home. So when you see them out there, we've got them placed around out there. We talked about it earlier today in the office. We talk about all of our first responders. You heard the doctor say the first responders, we have to keep them healthy, have to keep them on the front line, and we do. Believe me, our police, fire, EMS, our telecommunicators who are answering those 911 calls. But each of us, if you stop and think about it, are on the front line because we are the ones that help the solution. We got the solution by, as the doctor said, stay home, good personal hygiene, and we will be there. We won't need those first responders. They can go on and do their normal job. So let's everybody step up to the plate and do what we're supposed to be doing. We're going to be back in just a few moments with our interpreter to broadcast to our Spanish communities. Yes, Doctor?
Herb, could I add one more thing?
Sure.
You just prompted my memory. One thing I think is really cool going on here in our region is our hospital CEOs locally and our hospital chief medical officers. I was on a call last night with about a dozen regional chief medical officers from Maryville and up at Anderson and Gateway, Memorial, St. Elizabeth, Scott Air Force Base, down to Sparta, everywhere in between. And we have calls at least once, if not twice a week. The folks that you traditionally see working in competition are all stepping up together to work together. And we're all working for a common cause to keep our community healthy. And I think it's a wonderful thing to see, and the sharing of information and the sharing of best practices between hospitals and medical groups has been nothing but just incredibly encouraging. And we're asking the community to do their part. I want them to know that we as hospitals and medical groups are doing our part to work together as well, because it's been really cool to see, because usually these folks, I mean, I'm part of it, we compete. We're done competing. We're saying, how do we help each other? How do we maximize resources, which has really been a cool thing for our region. I just want to congratulate everybody for doing the right thing.
Well, I think it shows that with what St. Elizabeth's and Memorial is doing, they've committed to having a doctor come in on these briefings, such as yourself today, because I think it's important that our citizens understand it from the medical people on what we're going through here. So as I said, we will be back in just a few moments with our Spanish interpreter, and then we'll be back tomorrow afternoon at 3:30 for a briefing.